Fatigue is probably one of the most common consequences of having had a stroke, and it can have a number of causes, both biological as well as behavioral. As a consequence, it can actually last for years and years after one has had a stroke. But even though it's common, it's often missed by doctors, physios, and OTs while you're in treatment and rehabilitation. In terms of managing fatigue after stroke, there's really 6 E's that you need to remember. The first is educate. Learn about your own fatigue. Keep a daily diary of your activities and your energy levels, and that will let you know how to use your energy levels best. So for example, most people have most energy in the morning. So if you're going to do activities, plan them for when you've got the energy. The other common pattern that people find is that they feel they've got lots of energy, so they do heaps and heaps and heaps all at once, and then it takes them 3 or 4 days to recover. So those are some of the things that you can pick up by educating yourself about your own fatigue. The second E would be energy conservation. Try and manage to keep as much energy as possible by doing things like planning. So if you've got activities, plan them for when you're going to have the energy to do them. Delegate things that you don't need to do to other people, and prioritize. Do the things that need doing most. The third E is energy replacement. You need to have naps, perhaps, during the day. Most people who have lots of fatigue will have what we call the nana nap in the mid-afternoon period, because that's when you need to recharge your batteries. The third E is to ease stress. Stress will suck the energy right out of you. So learn strategies to cope with stress and avoid stressful situations. The final 2 E's are to eat well, because you have to again put energy into your tanks in order to expend it and to not have as much fatigue. And exercise. One of the common reasons why people get fatigue after stroke, or that exacerbates the fatigue that they might have, is that they get deconditioned. You know, you sit in a hospital bed for the first couple of weeks after a stroke, or you feel that you can't get up off the couch, and that actually makes the fatigue worse. So it's worth talking to your general practitioner or physiotherapist about a gentle exercise program for you that can help keep your energy levels up.